Emily, and I did my capstone presentation on evaluating bedside shift reports. So the problem statement that I found was that the most frequent communication period between nurses has been the shift-to-shift report. However, this has been very poorly defined amongst hospitals and different areas in the world, which this can lead to negative patient outcomes, more likely so like medication errors, falls, delays in treatment, increased length of stays, and like readmissions. So a statistic from the Joint Commission is that communication was the root cause for 65% of all sentinel events reported between 1995 and 2005. That might seem like a long time ago, and many years have went by since then, but just recently, in 2017, a national patient safety goal was to help improve staff communication. So this goal requires institutions to standardize an approach to handoffs during shift change or transfers between units. So my PICO question was, does performing bedside shift report improve patient safety as well as patient satisfaction as compared to not performing bedside shift report? So the P focuses on adult patients on a medical surgical unit. The I would be performing bedside shift report as compared to alternative ways of performing shift reports such as the hallway or nurse's station. And then the outcome is hopefully to improve patient safety and satisfaction. Some literature reviews I found, I searched multiple different ones. I came up with 5 different studies that were performed. The first study showed that by performing report at the patient's bedside, average report time decreased from 45 minutes in 2007 to 29 minutes in 2008. And 78% of nurses were satisfied with the report process as compared to only 37% the year before. So it kind of seems ironic that by performing report at the bedside, it should probably take longer, but I think once nurses were able to kind of get it down pat, it went a little bit faster. Study number 2 was a study that involved just observation of the patient and nurse interaction. There weren't necessarily any statistics that they showed, but they recommended for clinical practice, which included standardized handoff and reporting at the bedside. And then study number 3 showed it addressed patient satisfaction with the bedside shift report. So they did a survey for each patient, and only one question has statistical significance, and that question was that I was informed of my plan of care for the day. And then study number 4 was a study that measured nurses' satisfaction and level of comfort using the SBAR tool, which we have those papers here on the unit, so I don't know if people use them or not, but data was collected, and a majority of the nurses from that study reported that satisfaction with the SBAR tool, so 72% to 86% of nurses were satisfied with that. And then study number 5 recognized that the implementation of a standardized bedside handoff helped improve patient safety. So it was conducted 4 years after the standardized handoff was implemented, and patient falls decreased from 5 to 3 in 1 year, and then medication errors decreased from 32 errors in 2009 to 27 errors in 2010. We also had to just come up with like a theory that kind of went along with our capstone. I chose the Papelou's theory of interpersonal relations. It was developed in 1952, and it basically consists of 4 different phases. Orientation, which is the introduction of the nurse to patient, and then identification, which helps identify any patient needs that might be coming up, exploitation, which means working towards a common goal for that day, and then the resolution is the end of that patient-nurse relationship. So I thought, considering bedside shift report is usually that first interaction amongst the nurse coming on and that patient, that it worked well. Orientation meaning that they were introduced to that patient, they can anticipate any needs for the patient, like pain medicine, or they needed to go to the bathroom, anything like that. Exploitation, they were both working together for a common goal. I don't know whether it be discharge or getting pain under control, going to surgery, different things like that. And then resolution, the end of the patient and nurse relationship for that day. So if I were to carry out a study for this, it would be a quantitative and experimental study used to determine whether performing bedside shift report increased patient safety and patient satisfaction. There would be two methods used to perform the study: a control and experimental group or method for the nurses, and then a survey that addresses patient satisfaction for patients. The setting would be a small rural hospital in the Midwest on 2 different med-surg units. Sample size for patients would vary depending on how long each patient was in the hospital, and then for the sample size for nurses, it would total 40 nurses, 20 in the control group who would not perform bedside shift report, and then 20 in the experimental group who would perform bedside shift report. This is just an example of a patient survey, which I actually just copied from another study that was done. It just asks 5 questions for the patient, and then they can choose from strongly agree to strongly disagree for each question. And it just basically is, I was informed of my plan of care for the day. There was open communication between members of the healthcare team about my plan of care. I was satisfied with the amount of input I was able to give. My care providers worked together as a team, and the report given between care providers was given in a professional and confidential manner. Let's see. And like I already mentioned, the patient survey would be used to measure patient satisfaction with shift report. A t-test would be used to analyze data from the surveys, and then a Likert scale would provide results from the survey in a numerical form. In order to collect data from the control and experimental groups, we would look at objective measurements, specifically falls, medication errors, and treatment delays within the patients. So that would be used to determine whether performing a report at the bedside helped improve patient safety by comparing the control and experimental groups.
Mm-hmm.
And let's see. And then in conclusion, I think personally bedside shift report helps improve nursing communication, and it allows like 2 nurses to do like a joint safety check of the environment, making sure the PCA is set right, whether the patient's bed alarm is on, different things like that. And then nurses are able to quickly determine and anticipate patient needs before getting started. So whether a patient needs pain medicine or anything, they already know that and can plan for that, to bring it in with their assessment instead of just, running back and forth. And then I think patients are allowed to participate in the discussions and ask questions if necessary. My recommendation for practice change would involve developing a standardized tool for shift report and just letting nurses know from each shift, what to expect from the shift report, knowing what they need to report off. And then that way patients would also feel more comfortable knowing what was taking place during that time as well. And there's my references. And I'm done.
Thank you.